Hi, my name is Valencia Walker, and today I'm going to be demonstrating the insertion of a nasogastric tube. First, you want to start off with washing your hands as always. So I'm going to go over here and wash my hands. Some things that you may need. You will need gloves, of course. You will also need the actual nasogastric tubing. You also will need your lubricant to facilitate the placement down the nasal passage. Tongue blade. Also need a 60 cc piston syringe. Also, what you may want to have is a drape for your patient in the event that he or she becomes nauseated or begins to vomit. Reviewed over the supplies that we will need in order to insert the tubing. I am going to begin the procedure. All right, so Ms. Brown, okay. You said you didn't have any questions for me. I'm going to go ahead and start the procedure, okay? First of all, whichever nair that you're going to choose, that's the side of the bed you need to be on in order to insert the tube properly, to avoid reaching over the patient and making the patient more uncomfortable than what he or she already is, okay? You want to start off by raising the patient's head of the bed up to approximately 90-degree angle. Are you okay, Ms. Brown?
I'm fine.
Also, what I want to do is I want to go ahead and drape the patient, just in the event that she does become nauseated. We will first do some assessments, including her gag reflex as well as her nairs. We're inspecting the nairs to check for septal deviation, to see if we may have any problems. I'm going to check your nairs. And the purpose of this, again, is to check for problems that may cause complications with inserting the tubing. Also, we're going to check, just checking in the back of the mouth. And then we're also going to check for the gag reflex. And this is where you will use your tongue blade. And you can check, you will press back on the uvula and check for the gag reflex. Okay, gag reflex is present. Another assessment that we're going to do is listen to bowel sounds on Ms. Brown. Ms. Brown, I'm just going to have a listen to your stomach, okay? Okay, and bowel sounds are present in all 4 quadrants. That's important to make sure that she does still have peristalsis occurring. And the next step will be to go ahead and do measurements to see approximately how long of tubing we need or how far we will go with the tubing. Okay, so here I have my tubing, my NG tubing. And what I'm going to do is I'm going to start at the tip of the nose. Okay, and then I'll go down, move your drape, and I will go down to the xiphoid process. Okay. All right, and that is an approximate measure of how much tubing you will be inserting. Okay, I'm going to take my tape and I'm going to place a mark where I am ending, so I know not to advance it too far. Okay, now we're going to insert the tube. Okay, just to let you know, when I do insert and as I go further, I want you to take small sips of water and swallow, and that'll help facilitate the passage, okay? Okay, let me go ahead and redrape you. Okay. All right, so now I'm going to lubricate the end of my nasogastric tubing. The tubing. All right. And she has a cup of water in her hand. Okay, so when I ask you to swallow, swallow a little bit for me, okay? Okay, now swallow, swallow. And as you get a little bit in, once you feel a little bit of resistance, when it's going to go through the oral pharynx, you may want to have her lift her head a little bit. You want to go ahead and secure it Certainly this is not fun for the patient, so you want to do it as quickly as possible. Once we have secured this tubing, something that you may want to do is check the back of the throat to make sure that you see the tubing in the back of the throat. What you may want to do also is maybe clamp this to the patient so that it's not just dangling around the patient and putting, tugging on her nose. Like I said, the only sure, certain way to verify the 100% way and you know that it's in the correct place is a chest x-ray. But you can aspirate the stomach contents, one. You can you put your syringe in the tubing and pull back whatever content you draw out of this. You can place it on the pH indicator strip, and if it matches the pH of the gastric contents, then that's an indicator that you're in the right place. Also, what you may be able to do, take about 10 cc's of air, 10 to 15 cc's of air, connect it to your syringe. Place that here. And I'll listen right over the abdomen. And listen for the passage of air in the stomach. Listen right over the stomach, I apologize. And then we will hook her up to her enteral feedings only after the placement is confirmed through chest x-ray. Okay? So are you okay? Okay, so your husband will be in shortly to visit.